Now with a segment on cerebral aneurysms. Here's our reporter, Laura Windsor.
A brain aneurysm is a weakness in the wall of an artery, which can burst and cause bleeding into the tissues of the brain. Dr. Rosalinda-Menoni of Desert Regional Medical Center in Palm Springs explains the symptoms and treatments available.
An aneurysm, and in my case, since I'm a neurosurgeon, I'm talking about cerebral aneurysms, refers to an outpouching in the wall of an artery that can go on to rupture. Sentinel bleeds, meaning little warning bleeds, can be characterized by having headache, accompanied by very specifically a neck stiffness or pain, and usually it's characterized as, oh my God, that's the worst headache of my life, and comes on with some level of physical exertion. Congenital aneurysms have one set of characteristics, that is the kind that has a tendency to run in families, let's say, versus the kind of atheromatous, meaning high blood pressure type aneurysm, that happens with wear and tear in the brain vessels, just like the one in your abdomen can end up with that kind of an aneurysm. There's another type of origin to the aneurysm, which can actually be infective or inflammatory. And we see this all too sadly with the use of cocaine and methamphetamines and the agents that they're cut with. There still is the kind that you can also get after significant trauma to the blood vessels, but before you can tag the source as truly an aneurysm versus another kind of vascular malformation, or in some cases just a hypertensive bleed at a small capillary level, the gold standard is an angiogram. Now the MRAs and the CT angios have become much more sensitive, but still, for the most part, the angiogram is the gold standard. By reviewing the individual case and deciding which type of approach, and sometimes a combination of approaches are necessary because, unfortunately, the catheter procedure, like the surgery, has its own set of, let's say, inadequacies or complications, and sometimes a catheter procedure still will need an open surgery, or vice versa. Prevention, and again, if the causes that I listed are about 4 of them. We talked about the infective kind, don't get an infection. Now, of course, you don't always control bacteria going there or something from your heart, but if you got that because you're an IV drug abuser, don't do IV drugs. The other atherosclerotic types, of course, you want to control your cholesterol. Blood pressure control, of course, is the other case. So preventing the congenital type, that may happen, you know, it's a brave new world. Pretty soon we may be able to engineer, once we identify the gene, see, we haven't really gotten the offender so that we can say we can engineer out vascular anomalies from the development, you know, when you're a baby being put together in your mama. But that may come, that day may come.
Because a ruptured brain aneurysm can be life-threatening, seek immediate medical attention if you develop a sudden, extremely severe headache, particularly if it's accompanied by a stiff neck or nausea. I'm Laura Windsor for the American Health Journal.